I should have you like unscrew the tooth so you can actually take it out, but that's fine. So I'm gonna place a topical at the apex of that tooth. Yeah, way up in there, in the vestibule, right? Like up inside there. Like where you can put your tongue. So I'm gonna stick that up there. And I'm gonna have this already assembled. You guys are gonna do this. You're gonna get to know all the different parts of this. Okay, this is carbocaine, which means there's no epinephrine in it. Okay. Oh, this has been used before too.
I think we've all been.
See how I'm placing it in there nice and straight so I don't bend that little needle. And then screw on the cap. And then I can just leave it for him or pass it to the dentist. Okay. And I can put my cap in there like that. Okay. And then nest right above the tooth. Probably administer the whole carpule. And because this is surgery, I may give this injection on the palate to get the soft tissue on the palate numb as well. Right, and they use the mirror to have like it's called like a distraction technique of anesthetic. Okay, so now the patient's going to take a few minutes to get numb. That's when I can double check and make sure I have all my stuff up. Just getting them numb.
Oh.
What are the things I need up again? What do I need as a dentist in order to take out a tooth?
Basic setup?
No, not instruments.
Oh.
The
Consent form.
Consent form?
Health history?
Health history?
Dental history?
X-rays, dental history.
Which are?
Oh, you didn't say X-rays. Consent form, dental history, and X-rays.
Yeah.
I need an X-ray so I can see what I'm working with. If not, while they're getting numb, take another X-ray. Right? They may even do that. Oh, this X-ray's from like a year ago. Can you take a new X-ray for today? Right? Very common. We're not going to charge them. We need it in order to see. So, first things first. A lot of dentists will. I think the textbook even says like pass the Explorer to kind of check if they're numb. You're not gonna be able to check if they're numb with an Explorer. I mean, I guess you could poke around. I don't bother with that. I just pass my mirror or my cheek retractor, right? Whatever they want to start with. And I'm gonna pass them. This is what my dentists use. Okay, so this is very common. This is what the textbook references. Okay, what is this?
Kirkland, no, like Glick one.
Spoon excavator?
This looks like a spoon excavator. This is a surgical spoon excavator or surgical curette. This is called a periosteal elevator. Okay, it elevates periosteum away from the bone. Okay, so a periosteal elevator is gonna cut away the tissue from around the tooth. Okay, small
So
side,
kinda
big
like
side.
What's it called, like a scalpel?
Yes, but I'm not cutting with a scalpel because the tooth is exposed. So I'm cutting away the tissue, so I'm cutting those ligaments away from the tooth, okay? With my periosteal elevator, lifting the periosteum, okay? Obviously, when I start doing that, there's gonna be bleeding, so I'm gonna have my surgical suction going. Smaller, so I can get in there and not get in the way, and aspirate out any of the blood, okay? So periosteal elevator. Then I'm gonna pass my, you know what this is?
Apex elevator.
Apex elevator, this is a Selden, or it's just a straight elevator. Okay, my doctor, I think, called this the wide. One of his favorite ones had a black handle, he called it the black handle, whatever. It's an elevator, it's a straight elevator. They're gonna use this to luxate, that's a fancy word, to rock it back and forth in the socket in order to loosen it. Yeah, to wiggle it. So I'm gonna use that to start to elevate my tooth, okay? This is also an elevator, but not a periosteal elevator, but a tooth elevator. Okay, so it's a straight elevator. I'm gonna start to lift out my tooth. So I'm gonna be using this. I'm gonna have this ready to go, right? So I'm gonna take this and pass this, right? And after on that elevator, I'm gonna have my forceps ready to go, right? Because once he loosens it up, either that's gonna pop out and we're done, or I need to pass him another forceps. Now this forceps, okay, I said I'm taking out 14. I would be like, where's my good assistant? Because this is not going to help me. Okay, this is called a FAF 151. Remember, Bacardi 151 puts you on the floor. Okay, it's a lower. The curve goes into the hand, and this curves down, so it's taking out lower teeth. It is universal, which is a good guess, but it's not going to work on the upper. Okay, it's designed for the lower. So I could use a 150, which is for the upper, right? So that's the same thing but designed for the upper. Or what I was really looking for was an 88L. Okay? Do you find an 88L? You might want to pause the video for right now. On the side. It has 3 prongs in order to grab the tooth. So the bend, usually with the upper, it has a kind of a funky extra bend to get in there. Yes. So there's 3 roots. This is going to grab around those roots. So this one goes into the furcation on the buccal, and this one wraps around the lingual or the palatal root. So the tooth looks like
Is
this.
this to make sure you like get all the 3 roots?
It's just a way to grab the whole tooth so nothing is left behind. Exactly. So if I have a tooth to grab, this is perfect. If there's broken off the gum line, then I have other issues, right? But this is a 4-step extraction, so it's a simple, full tooth, no risk of it breaking kind of thing. So I grab my tooth. They're also going to do a little more luxating, right? And it's kind of a slow process because if I just yank it out, I'm going to cause trauma to the bone, and it's going to have more post-operative stress and pain. Okay? So the least amount of stress and pain is to luxate it first, loosen it up, to elevate it, and then gently, with force, pull it out. I've seen tiny little women with tiny little hands take out teeth. Like,
Yank it out.
it just takes the right amount of force in the right
Let's
direction.
say it breaks. What kind of forceps do you use?
Wonderful segue. So, oops, all that came out is a crown. I now have 3 roots stuck up in the socket. That's when I would have this ready to go, but I wouldn't open it because normally it would come out, everything's good. Oh, it didn't. So now I need to pick it out. I may pass in my surgical